Following segment sponsored by Tennessee Cancer Specialists.
Once again, I have the privilege of being here at Tennessee Cancer Specialists in Kingsport, and today I am joined by Dr. Jaishankar here, and we're talking about treatments, and we're talking about new treatments, and they're being new treatments that are being tolerated well by your patients as well.
Absolutely, and that has been the promise of oncology in the last decade, is that our treatments are far better tolerated. The toxicity profile is much lower, simply because there have been innovations in chemotherapy that makes it far better tolerated. But in addition, there has been the promise of immunotherapy that has come along. And immunotherapy is a medication or a drug or a set of pharmaceutical agents that we have that stimulate the patient's immune system to fight cancer. And so we find that the toxicity profile of these drugs are much lower. So I have older patients, frail patients, who we were not able to treat with our agents in the past for cancer treatments. I now see them walk in and walk out of the cancer center in the outpatient setting, doing extraordinarily well, taking treatments for even advanced malignancies and cancers. And then they're able to fashion their lives around the treatment and yet go to Charleston, go to the beach, make their trips, have family reunions. And I always believe as a physician that I would not like to intrude into the patient's life. And we say, we will try and devise treatments so that you can still have the best quality of life that is possible with this diagnosis and with the treatment. So immunotherapy has delivered on that promise, and that's been very heartening to see that.
Also, your treatments are becoming very precise and very personalized to each individual as well.
Absolutely. And so that has been an absolutely fascinating field to see that no two cancers are absolutely the same. No two lung cancers and breast cancers are absolutely the same. And so at a, we've kind of in a very big fashion said it's this kind of lung cancer and that kind of lung cancer under the microscope. Today, we're actually able to look at the molecular fingerprint of these cancers, and strategies and drugs and oral medications have been devised called TKIs, or tyrosine kinase medications, specific for each of these molecular subtypes. Now, we are finding and defining newer molecular subtypes for a group of cancers every day. And the hope and prayer is at some point that the vast majority of, say, lung cancer, for instance, we would have an oral drug possibly. At this point, it's about 20% of lung cancer that can potentially be treated with an oral drug. So the hope is that we will have more drugs in the future.
In addition to treating the cancer, you're offering supportive care as well for each patient.
Yes. So it used to be that the nausea, the vomiting, the toxicity of these treatments was prohibitive. Quality of life was impacted. Today, we've had wonderful advances in supportive care, and our strategies for cancer delivery have become so effective that patients are able to take the treatment and still be out there in the community doing things. I'm not going to be able to say that they lead absolutely normal lives. This is a fight against cancer, but to a large extent, it does not take over your entire existence.
No cure for all cancers, but the treatments are there, and you're making sure that those folks, they have access to those treatments that are available.
Absolutely. So access is an important part, and there are treatments out there. There are newer treatments coming out every day, but the more important thing is to make sure that the treatments we have do reach the population, do reach the patients, and we're able to get that access in their own community, in their own towns, and that has been wonderful.
When folks walk through the door here, you're walking on that journey with them. And I think that's very important as their overall care. You're looking at the overall patient, not just focusing in on the cancer, but taking care of that entire patient.
Absolutely, because at the end of the day, we always say the patient is the North Star, and we follow the patient. And I like to say that my promise to my patients is that I will walk beside them, that we recognize the terror and fear that the word cancer strikes. And some of us as physicians have actually stayed on the other side and watched and heard news being delivered, and the not knowing, trying to read doctors' faces and figuring out what's going on. So I work with a passion, with the belief that knowledge is power, and that my job is to empower that patient and that family at that point in time with everything that we have available, the good and the bad, and be honest about it and say, these are the next steps. There's always a path. There's something that can be done.
All right. Dr. Jaishankar, thank you so much for taking time with us today.
It is my pleasure.
Folks, Tennessee Cancer Specialist, offices all across the Tri-Cities. I encourage you, if you need them, they're here for you today.
The preceding segment sponsored by Tennessee Cancer Specialists.